My name is Jennifer Edens. I've worked as a clinical microbiologist for 30 years. A couple of years ago, I got my PhD in public health and epidemiology, and I was very fortunate with that I got to actually do a huge research project using doTERRA essential oils as well. I wanted to really dig in, make a rigorous study, and one of the things I wanted to do was look at keeping levels of yeast, ways to keep yeast at lower levels in your body so that they are not causing problems later on. And so what I did was I took 117 previously frozen isolates that we had recovered in the hospital, and then I tested them against, I tested it against oregano, lemongrass, and I tested it against thyme. What I did was I added 10 microliters, which is a sixth of a drop, into a 5 milliliter vial that had nutrient broth in there for the organism, and then also 10 microliters of the organism growing in there that we did the half McFarland again. And so I put that in there, and then at 1 hour I took 10 microliters out, plated it out, saw how many colonies were growing. And with oregano, there were never any colonies. At 1 hour, there were no colonies. At 4 hours, there were no colonies. Letting them grow for 48 hours, there were never any colonies growing. So to me, that showed that oregano was very significant at being able to keep things in balance and promoting organisms from not getting overactive in your system. When I talk about like 5 mils of nutrient broth, or when we did the initial testing, this is kind of about how much is in a tube. And then what we would do is I would add 10 microliters in the last experiment that we talked about. I would do 10 microliters of the essential oil and then 10 microliters of the organism. And so this is a little pipette, this is a pipette tip, and I would just go in here, and it's got a number on it, and it's calibrated to 10 microliters. I can go up to 100 on this pipette. We have lots of different ones. And then there's just a little bit in there, I don't know if you can see it, but then I would just inoculate it into the specimen. And just drop it in there. And it's just basically a little tiny drop in there, and you can kind of see it not really dispersing in there until I kind of give it a little shake, and then it's dispenses in there a little bit. And then if we had our organism, we'd also take, say this is our organism, we would take 10 microliters of it, and we would also place it in that specimen container as well. And then we would, what we'd call is a vortex, and then we'd shake it up real quick like that, suspend everything together, and then it would go in the incubator. And then we inoculated them with all of the reagents, and then we inoculated with one specimen. So this is all for one organism that we isolated. And then after 1 hour, I took each one of these tubes and I put it out on a agar plate, and I didn't bring one with me, but they're about the size, this big around, and then we just inoculate it, and then I struck it out, and then you could count each individual colony on there. And we might, I have some pictures that I can show you of it later, but so that's about the size of the plate. And then it incubates for 1 day, and then I look at it and count all the colonies, and then it incubates for another day, and I count all the colonies again to make sure there's not any more growing, because if more of them are growing, that means that the organism was being inhibited by whatever reagent we put in there, but it wasn't being killed. It out once the oregano was isolated or put in there, and then once I plated it out from 1 hour, 4 hours, 8 hours, and so on, it did not ever grow. it turned out well because we were able to collect the data points that I wanted to collect, and we got a lot of really good information out of this research. And I wanted to reiterate that one of the reasons that I'm able to put out such a rigorous study is because of the high quality of the oils. I know that I can use this oil and then I can turn around and use it in another experiment a year later or 6 months later or whenever. I can buy another oil, get another oil to test, and I'm still going to get those high quality results because it's dependable and it is consistent. When we first started out researching or wanting to research essential oils and trying to get physician buy-in, that sort of thing, it was tough. There wasn't a lot of information out there, at least locally, that contributed to science that said, hey, this stuff works because we did a rigorous study. Some of my first encounters with speaking with physicians, Dr. Hill likes to talk about some of those stories, was a little bit tough. We kind of got accused of all sorts of things and that it was a bunch of hocus pocus and that sort of thing. And when I first found out that that's how the perception was of essential oils and I had started researching, I just wanted to make sure that I could prove to them that they were effective and how they were effective, because some people in science, that's the only way. You got to back it up with the results of science, and it's got to be a rigorous study. It's got to be a good study. Otherwise, they're never going to believe you. And so I think I started doing that, and then all of a sudden, a lot of other people started doing it. And it wasn't just essential oils here in the United States, but there is so much research going on in other countries, and I think that helped to maybe open up some people's eyes that thought, wow, all these other countries have published thousands and thousands of literature, research that are well respected on essential oil usage. Maybe I should start paying attention. And then so I think that a lot of people have become more receptive as we have moved on, and the research has strengthened what's been being said about essential oils.